Hello, everyone, and welcome. Thanks for joining us today. I'm Barnard Crespi, and today we are talking about a challenge that most every healthcare organization is facing. How to do you improve your revenue operations with dealing with staffing shortages, rising costs, and patients who expect everything to be easier and more convenient. Joining me today, I have Jonathan Reek, who's a healthcare consultant, solution consultant with Global Payments. Jonathan works with hospitals and healthcare organizations across the nation in North America, helping them improve the way they manage payments while creating a better experience for both patients and staff. Jonathan, it's great to have you back.
Good morning, everybody. Yes, it's great to be here as well, and I'm looking forward to the conversation here about the revenue cycle management for hospitals.
So, Jonathan, let's start with the big picture. It feels like every hospital is being asked to do more with less. Staffing is tight, budgets are under pressure, and patients expect a much better experience than they did just a few years ago. Are those the same conversations you're having with healthcare organizations today?
I love it. I love the way you put that. To do more with less is the perpetual issue in healthcare. Budgets are tight. Budgets are often non-existent. Funding is often non-existent, as well as the conversations we're hearing all the time across healthcare organizations across Canada. It's really a perplexing issue where you're asked for more output, better results, without necessarily the funding to follow suit. So oftentimes the cases that we're building have to be somewhat positive, where you're generating more revenue than you're actually absorbing and you're taking on for whatever costs you might be needing to make that happen. So the business cases have to be very thoroughly built in order to do more with less.
So one of the things that I've noticed is that payments aren't really usually the big problem, but they become another thing staff have to manage every single day. It may only take a few minutes, to process a payment, but when that happens, there's dozens, even hundreds of times a day. It becomes a real operational challenge, and again, they're competing with all these other priorities that staff in healthcare and in hospitals actually have to deal with every day.
Yeah, no, 100%. Payments are afterthought. I mean, most of the coverages by insurances, by the government, and so on and so forth, payments are small, if any, of a fraction of what they're doing on a daily basis. The last thing they want to deal with is how to accept payments and how to optimize those payments. That's where we often step in and we try guiding them a little bit more in terms of what they can and cannot do and how to do it most effectively, how to accept more payments faster, better, and reduce the amount of going in collection. So it's a big issue, but it's often an afterthought where they don't have necessarily the time to think about it or consider it. And so finding the right partners to join in and have a conversation and learn about what other organizations are doing is probably the best way to learn and enhance how you're doing it today as an organization.
So let's talk about where organizations are feeling the biggest pain. Payments seem pretty simple at the surface level, but behind the scenes, there's a lot of manual work today. From conversations that you've had, we've had together, that we talk to, service providers. Where do you see that hospitals are struggling the most right now?
Yeah, that's a really good way of putting it as well, where payments seem super easy, where you have a terminal, you tap your card, you insert it, and you complete payment, and there you go, you're good. That is a very, very high level, 30,000 feet look at how payments are being collected. There's so much going on, not only from a compliance, from a technology perspective, but also from a workflow perspective, right? All three have to work very cohesively together in order to make this a very fluid transaction, but also very easy in the back end. What we're often seeing is organizations having disjuncted kind of processes where you're doing this process for this type of invoicing and this process for that type of invoicing. But that's just not just two different types of invoicings. You have sometimes 10, 20 different ways of invoicing, getting capture, different payment methods. It becomes a whirlwind. And not only that, but oftentimes these processes get added on across time. So it's not day one, here are all the different ways. It's day one, here's this. Year two is this. Year three is this new process. Year 3.5 is now this process for that process. you just keep adding on, and before you know it, here you are, your organization has existed for 60, 80 years, and you have 20 different processes for 20 different payment acceptance, and you don't have the time to go back and review, because again, payments are an afterthought. It's the last thing on their workbench that they want to worry about and be concerned about, especially when you start getting into PCI compliances and privacy and all of this as well. So what we're often seeing is 20 processes for 20 different payment collection methods and whatnot, and it adds up a lot of work where spending maybe 20 minutes just reevaluating how it's being done and working with a partner to evaluate how you can optimize those methods could be a very
Well, it's interesting because what you're saying is the current, healthcare has been around for a very long time. A lot of these organizations have been around for a very long time. Staff, are move on from one organization to another. There's no one person who actually owns this process that, to
very
your
true.
point, has been built. And I'm not going to go 80 years ago. I'm going to go just 20 years ago. That has been stacked. To use your 20 different processes for 20 different channels, but they've been stacked one on top of the other, right? And so we do tend, like to your point, I mean, there's a lot of manual processes that are connected to payments, and that, staff is spending way too much time choreographing and reconciling, and I'm going to call it embedded in patched up processes. So there's a lot of delays in following up on paid balances, for instance, because there's a lot of manual intervention. When you have this, to your point, when you have this 20 different tasks within a process that have been built one on top of the other. And one of the things that's interesting is that we've seen is that no one person really owns the whole ecosystem. And many times, individuals do and leaders do inherit this, and they still have to operate. And as much as we say that sometimes we see that there's small inefficiencies, when they actually add up over time, it becomes a much bigger issue. Because if you needed to improve that process, you would need to really understand what it is that's underneath the hood. And to your point, I mean, this is a stack that's been building on top and top and on top over time.
Oh
Now,
yeah.
so, one healthcare organization that we worked with, told us that their staff were spending a surprisingly amount of time every day just answering payment calls. Every payment meant taking card information, answering questions, or transferring the call, to the right team member. It wasn't necessarily one massive problem. It was just those hundreds of small interruptions through the day that really added up. I mean, have you seen similar situations?
100%. 100%. Most organizations we're speaking with that don't have like an automated phone system to take payments do this manually. And it's across the nation. It's a very standard process in most organizations where you have staff actually listening in, talking with a patient, capturing the sensitive card data, entering it manually, completing the payment, reconciling back into the hospital information system that, Carl has paid his $1,200 outstanding. Everything is now reconciled, and then they're good to go. So that could be a 5-10 minute conversation. Depending on demographics, it could be longer, but that small interruption throughout the day times 20 of those for each different rep, it adds up very, very quickly. Then there's the switching cost, right? Because that's not their only task, right? They have multiple different tasks, so they're switching from one thing to the next over and over. And like you put it, an interruption. So that friction point among staff members can create some turnover as well, where it's dissatisfaction with the processes and kind of feel like a burden overall. And this is where some organizations have approached us to see exactly how can they automate this, reduce that burden for staff. Obviously, you won't eliminate entirely the process of over the phone. Some people just want to talk to an actual person, but there's ways of making this a little bit more seamless for patients.
Well, I think that I always try to use a rule of thumb is a process that is repeated. You have to repeat. You actually use automation for, and wherever judgment is required, you use a human. In what I'm hearing is that there is staff being used or a task to do repeatable work, very task based, whether it be, let me take that payment, let me input that payment, let me post that payment to the account, where really tasks that do not require human judgment. And then you actually have this inflow of calls, because I am sure that hospitals get a ton of calls during the day. I mean, their billing teams about, why is this on my statement? Or was that in my statement? Why am I getting that statement? Things that require a lot more judgment. These are patients that have to be put on hold so that, because there's only a queue and there's only so much staff. We talked about, staff shortages, where they actually have to put them on hold in order for them to just finish up that job that could be addressed with automation. And this is a fine balance. This is a question is like, what part of the job requires judgment, and what part of the job is just purely, a repeatable task that can actually be automated. To your
Yeah.
point, there's things that can be automated. Now, you know, patients have changed. People don't want to wait on hold anymore if they can avoid it. And if they can book a flight, order groceries, or pay other bills online or over the phone in a few minutes, they expect healthcare to just be as convenient. So, how are hospitals responding to those expectations, at least the ones that you've seen modernized?
Yeah, absolutely. So some ways of modernizing payments, making it in a way that patient expect to interact with, making that process as seamless as possible, to ensure that you're collecting as much as possible. Right? If there's friction, people are going to hesitate. Right? That paper statement that they're getting through the mail, $45, and then they have to go online or they have to show up in person to pay, and it's not an easy process. You can bet your bottom dollar that little paper is going right back at the junk drawer, waiting for the next time, next week, next month, whenever this weekend, so on and so forth. They forget about it. Then here comes 60-day outstanding. You get another paper statement. Then maybe they're likely to complete that payment if they're really motivated to do so. If not, going to 90 and then collections. So you definitely want to make it as seamless as possible to avoid all the friction points and make sure that patients can just pay within seconds or a couple of clicks like they're used to on Amazon. On Amazon, you can legitimately misclick and you buy something. So make it a very, very fast, very, very seamless. So this way you complete as many payments. There's so many ways. So many ways. Online is a great one. A lot of organizations are adopting this or have something of this nature where you can pay online. Sometimes that process is a little bit not as smooth as you would want it to be. Multiple pages of forms, confirmation, validation of information, finding your guarantor ID, your MRN, your patient ID sometimes is required, and you don't really know where to look for that. It might not be on your invoice. Then also finding the place where to pay. Sometimes you can just go on a hospital and pay bill, and you might pop up the online website. Sometimes it does not work. You want to make sure it's always running. Right? A runtime. You want to make sure it's always available. We've seen sometimes where you go try to paying a bill and the system is down. You want to avoid that at all costs. You want to make sure you have something reliable, because if the system's down, you're going to have to send out another paper statement 30 days later in order to complete that payment. There's so many ways of making this seamless. Partnering with the right organization is definitely the first step, right? Where you want some multitude of payment collection processes, right? If you just offer online and it's not available, or like my grandmother doesn't have internet, she can't reach and get access to that to pay online, she'll have to show up in person or maybe call someone and give sensitive information. You want to make that process seamless. Sometimes like with IVR, some of these automated systems are a great way of doing so. We were talking about processes taking manual labor and finding ways in which you can automate that, repeatable steps that don't require necessarily judgment. This is a great way. Phone payments are a great way of automating that. I mean, we've seen organizations time and time again reduce their call handling from their staff by 95%. That means
So that means that they can focus. Yeah,
yeah,
they can focus on answering more relevant questions that require human judgment. And I mean,
exactly.
because the billing team, I mean, again, from what we hear, they're overly stretched, right? So the question is, well, a decision needs to be made is, are they going to be doing transactional work, or are they going to be doing work that requires their judgment? And these are very highly skilled like people within the billing teams. I mean, this really becomes about how do we design the work, or how organizations design the work of their people to address, again, we talked about staff shortages, we talked about, doing more with less. And that really is, one of the many benefits of the automation elements of how we automate the process, not just the payment piece, that can actually facilitate and alleviate that. And I remember another healthcare organization that shared something very interesting with us. they stated that sending automated payment reminders after hours, they found that more patients completing their payments in the evening than during regular office hours. And this is very interesting because most organizations and healthcare providers that are still managing, I'm going to say, responding to patient payment inquiries and calls are doing it during business hours, 8 to 5, uh, usually Monday through Friday. And the data from these, group of organizations who have actually done payment reminders are seeing that the preference is taking place not when the offices are open, which from one way or another, that has to impact revenue because, if you're not prepared to take payment when patients are ready to pay, like you talked about, I call it the Amazon phenomenon. Then what actually ends up happening is you're leaving revenue on the table because our consumers have other bills to pay, and if you're not available when they're ready to pay you, they may choose to pay another bill, whether it be a utility bill or their cable bill. So it makes a lot of sense that people are at home from work and finally have the time to take care of those things, and we need to be there to satisfy that readiness on their side. Are you seeing more organizations recognize the value of giving patients flexibility?
I absolutely. I mean, the more options you give, the more likely you're about to get a payment inside of your organization. Something interesting to note on that is, right, if you have just online, you might be catering to a lot of demographics, not 100% of it. So offering versatile options can definitely increase that payment collection. So we're definitely
Well, I
seeing.
mean, you talk about demographics, which is quite interesting. I mean, what we were conducting a very interesting study not too long ago about, there's this, I'm going to call it misunderstanding that as the generations begin to move, more people today want to use online mobile features, and then that's how progressively as they age and become parts of other call it age groups, that they will continue that method of payment. And what we're actually seeing is that, for instance, talking about phones, as your social interaction becomes a little bit not, it's not as active. uh, People do crave social interaction, and calling into whether it be talking to a person, whether it be a call center or a billing team, becomes part of that need to fulfill that for social interaction. So, I don't believe that we'll see patients stopping to want to talk to people and to talk to a person to make a payment or to find out something because, you know, they may be sitting at home, they're retired, they're not going to work anymore. So picking up the phone to talk to somebody is part of that human need for socialization. And again, that's still an ongoing study that we're doing, but it's interesting the data and the conversations that we're having around this. Now, one thing that I think is important is that automation is not about replacing people. We have a lot of these conversations when we're talking to managers. It's really about helping staff spend less time on repetitive payment tasks and more time helping patients. Is that what you're seeing?
Yeah, this is often a conversation whenever we talk about automation, about having the end-to-end process fully automated. We're talking no staff intervention in the payment collection, in the reconciliation, in the reviewing. Everything happens automatically. It is definitely a point of discussion where we don't want to eliminate jobs either, right? The public sector that can have potential bad reputational damages, and so you definitely don't want to replace people. But what we're seeing is the turnover in a lot of organizations is due to the friction related to some of these processes.
So I think it's interesting because a lot of people choose to work in healthcare organizations because they want to be able to work in meaningful environments. We do know that billing teams and a healthcare provider not necessarily are part always part of the healthcare, delivery, but they are contributing to the delivery of services. And that for a lot of our people, they make that choice because they want to be part of something bigger. And I always think that giving staff more time to focus on providing service to patients is, it's instead of processing payments. Reducing, we want to be able to letting automation handle that routine payment task, right? Versus, passing that along to a person. You talked about friction. I mean, if, we've spoken to many people who've worked in these, in healthcare environments in the billing side and the billing side overall. And I mean, if you ask them, what's some of your favorite things to do? It says, well, I like to really help patients or customers resolve their issues. Taking a payment, taking a credit card is not necessarily resolving an issue. So that sometimes, the more and more goes towards that channel, the more they have to do with that particular transactional task. My opinion is it probably takes away from the satisfaction of working in that environment.
Yeah, but as well, taking that sensitive card data, I
Oh
wouldn't
yeah,
enjoy the process either, right? You're definitely gonna have people complaining, like, "What do you mean I give you my card data?"
They do. They do.
So,
They have to. You're right. You're right. It's like, and some people, to your point before, we know that some hospitals have actually implemented, automated payment technology that is specific designed to remove staff from handling the sensitive credit card information. And we've heard staff, don't you have a more secure way to handle this? Are you recording my call? Are you writing down my credit card? So they do become challenged around those things, which is,
that does not
it's an
sound like
interesting,
fun
it's
to
an
me.
inter-
No.
yeah. So, one example that really stood out to me was a healthcare customer that introduced automated phone payments. And within just a few months, they saw payment related calls to their staff drop by 96%. Now, I mean, the manager who shared this was super excited with me about this idea that, oh my God, I've removed 96% of those transactional costs that my staff don't want to deal with, or they prefer to be dealing with patients. And that wasn't, about eliminating the job. It was simply meant their team could focus on patients instead of answering routine payment calls all day long. And that's a significant operational improvement. That's like 96%. Now, you started talking about PCI before, so I'm just going to jump into this. Security has always been part of the conversation in healthcare, whether it be security, privacy, and organizations already have enough sensitive information to protect. The less payment information staff have to handle, the lower the risk for everyone. How are organizations approaching this today? What are you seeing? What are you seeing that progressive healthcare organizations are addressing this? I know you probably have a lot to say about this because you mentioned it a few times during this call.
Uh, compliance, healthcare know more about compliance than the average Canadian, that's for sure. There is a lot of compliance requirements. Name it, and there's a requirement from a compliance agency for sure. So whether that's patient data, whether that's credit card information, there's a lot of compliance work involved, and oftentimes people don't necessarily want to embark in a big project that's going to require tons of compliance review and bring that to the board and the project management office and so on and so forth. That's often what we're seeing. And so the ways in which you can operate and operationalize a lot of these items and these processes through some automation can drastically reduce a lot of those compliance risks. IVR, something we've been talking a lot about here today, is a big point of that, where with IVR you're reducing that card data collection from manual processes with actual people listening in. You're removing that entirely. So going from maybe 320 requirements from a compliance perspective down to 20, 30 different compliance requirements. It is a drastic decrease in requirements. So going towards modernization, becoming more of a compliant organization and complying with all of the different compliances. I think I've said compliances maybe 15 times in this last couple sentences. It's absolutely wild. But yeah, automating it can reduce a lot of your security risk.
So the key points here are protecting patient payment information,
Yeah.
reducing the need for staff to handle credit card data, and we know that not just a credit card but any PHI information supporting PCI compliance and reducing, at the end of the day, is not just reducing the risk to the patient, but also reducing organizational risk. And a lot of these automated solutions that we've been discussing, or processes, I mean, address all these four important points. And I think that's an important point, because better security doesn't have to make life more difficult for staff or for patients.
That's a
And
really
many
good point. That is a good point. We often see where people think it's a trade-off, right? You're either making it extremely secure, but you're making it extremely difficult process. And so it's 100% a trade-off is kind of the perspective was what we're seeing. That is not necessarily the case.
Yeah, in many cases, the more secure the process is, it's actually easier process because it's a lot more
Correctly.
defined. And
Yep.
you talked. I'm going to talk to the beginning of the conversation. You talked about 20 different ways in which a payment is accepted that expands, the scope of how things are done, not just a security component. And
Yeah,
and
there's a lot of
part of
different
that
configuration.
process of compressing how things are done can reduces the security risk, but it also makes it gives it an opportunity to streamline the business processes and making things a lot easier to manage. Because nobody, and I'm going to call that's a silver lining of being really process and very security driven, is that allows you to actually take a look at how work is being done. And again, like to your original point is, these stacks have been built over the last 20, 30, 40 years. Doing a reevaluation of how they work help you improve the organization as a whole. Now, so for some listening today, who's thinking this all makes a lot of sense, but where do we begin? What advice do you have?
Yeah, that's a really good point. Oftentimes, where you have 20 different processes, and sometimes you're the only person revolving around the entire system, you have full ownership of it. And then sometimes there's some organizations where it's 20, 30 people that have ownership of this process. Where do you start? The best way to start, and this is something we've helped a lot of organizations do, is map the process. Sit down, whether that's with you, just take the time, figure out the entire process, every single payment flow. Where is the data flowing to? Where is it going? How it's being collected? How it's being reconciled? Map it out. And if you have 20 people that are owners of the 20 different processes, sit down with all 20, have an hour-long meeting, and just map out the processes. You're probably going to find some overlapping. You're going to find some completely different processes. You're going to find, like we've worked with some organizations with, they have 5 different reporting platforms, and they can pull data from 5 different reporting platforms. That is not an easy process. There's ways of conglomerating vendors as well, right? Sometimes you have 3 different vendors for the exact same thing. So it's 3 different agreements that your procurement team needs to manage. There's a lot of ways in which you can simplify and streamline these processes. Sit down, map the process is the single-handedly the best place for you to start. Data, without any data, you can't do anything, right? Like we're tracking here 96% reduction of IVR usage. If you don't track any of that data, you can't evaluate where to go next, what to do, and where are the areas of need of improvement. So if you don't have data, there's nowhere for you to go. Start with the data, start looking, start mapping, and you're going to see different ways. And you can put like red sticky notes on all the different issues and whatnot, and you're going to see red sticky notes flying everywhere. Those are where you will start afterwards.
Yeah, something, it's interesting because the way, to think about the payment, the process is that, before a patient ever clicks on pay, an invoice has been created, a business rules have been applied, patients' records have had to be updated, and only after that happens, then the payment really comes in. And once a payment actually happens, I mean, you have settlement, you have reconciliation, you
Mm-hmm.
have, you're talking about compliance, right? And when something doesn't quite line up, right, suddenly, you got your billing team is involved, the finance team is involved, you may call even IT, you may call your vendors, you know, everybody has to actually come in to figure this out. And specifically to your point, this gets a lot more complex when the process is not mapped out. So I'm going to say that most organizations do a pretty good job at managing their own piece of the journey. What's much harder is seeing the whole picture, right? So you start talking about this mapping exercise, right? And But it's also, understanding where that manual work, how the exception handling, you got teams chasing after information. And I'm not even going to we're not going to talk about purely automation because there is a lot of use for automation in the process. But the reality is, if you don't understand how money is really moving within your organization today, is that automation or anything that you apply is not going to fix it. In fact, it can just, when you try to automate a process that's already inefficient, right? The organization is seeing the biggest. So you need to understand that. And going back to your mapping, because I'm a really big believer in this whole mapping exercise. Organizations are seeing the biggest results are the first ones that understand how the flow of money actually works from the time that a statement gets generated for a patient and all the way how that makes it all the way down to the general ledger.
Yeah,
And once
knowing
you
where you
can
stand
actually
today. Yeah, knowing where you stand today is the best place to start.
see that workflow,
Yeah,
you can start improving it.
there you go.
You can reduce friction, like you've talked about friction many times. You can improve the patient experience. You can strengthen compliance. You can make life a whole lot easier for the people inside of the organization. So, I usually always suggest, like to your point, is try to understand how money is flowing from the time that you're putting that statement, how all the different points, and you talked about 20, and I would not be surprised if 20 would be probably even an understatement, right? Because it does happen. We've seen it, and the bigger the organization and longer they've been around. But really is understanding a leader can spend some time taking a look, and I know that you can facilitate this, how money flows through their business, but it is very important to actually understand how money flows from the beginning to the end and back into reconciliation, because that is just having that understanding can help improve the overall process, have a vision that's never existed there before.
Yeah, yeah, mapping that out.
Yeah. So, Jonathan, thanks so much for joining us today. One of the things I hope everyone takes away from this conversation is that improving revenue operations doesn't mean a massive transformation. Sometimes it's a very small improvement that have a bigger impact, making it easier for patients to pay, reducing workloads away from staff, you talked quite a bit about improving security and creating more efficient processes, which you mentioned on several occasions. So at the end of the day, that's really what this is all about. Helping healthcare organizations spend less time managing payments and more time focusing on helping patients. Jonathan, thanks again for sharing your insights, and thanks to everybody who joined us today. We appreciate you spending part of your day with us, and we look forward to seeing you on our next webinar.
Take care.